I think probably in four main ways. What it's doing now is helping with self-care and self-management. So that's a lot in the preventative work area. It's also helping the health systems themselves, because the more we do as patients and to look after ourselves, the less cost and burden we are placing on the healthcare systems. Also from the data that we're collecting in our apps, and then we can then share with our healthcare professionals, and that will help improve diagnosis and treatment. And then generally in helping to create these networks where everybody has a much greater understanding and stake, so that you have the clinicians with the patients, with the tech industry, the app developers and the healthcare systems all creating and coming together to create better outcomes for patients. Well, I think mobile health just means, for most people, it is their smartphone. And that's their primary way of interacting with mobile health. That's obviously through apps. It just means health that you carry around with you, where you have access to finding out about your data, updating your results. So these could be your vital signs or whatever it is of your particular condition. And then an easy way of sharing that either with your clinicians or with your peer group or with fellow sufferers, so you get the support as well. Everybody talks about big data. I think that is really going to be the major change, because you can monitor 24/7 what is going on. So instead of seeing your consultant twice a year and they just have a spotlight on how you are at that moment, they can really see the changes in symptoms. It also helps the patients notice what are the triggers and the symptoms for them in the case of sleep, food, mood, all these kind of issues which have an impact on their health. Where mobile has really helped is it's helped level the playing field, the power balance between the patients and the clinicians, because now it's a new field for everybody. Most clinicians are no more techie than any other patient, and they're no more savvy about how to collect the data and how to deal with the data. So the patient input is even more important, because they are actually providers of an awful lot of this data now, which is then incredibly useful for the clinician, obviously for diagnosis and treatment. We will probably move from individual apps into more integrated platforms and systems, because nobody wants to have 500 apps on their phone. It's not feasible. But I think the progression towards fully integrated digital health and this eHealth infrastructure that underpins it, like the hospital systems and all of that, is going to carry on. I just think purely from financial reasons alone, no governments, no matter how wealthy, can afford to cope with the burden of diseases in the old way. So we will have to have a digital response.